Welcome to Somprana. I'm Dr. Aarti Soorya. I'm an integrative medicine physician.
And I'm Sara, Herr. I'm EFT tapping and somatic practitioner.
So today we wanted to talk about the pitfalls of functional medicine. So I'm trained in it. So I'm just completely being honest here about, both sides. We talk about conventional medicine, we talk about functional and holistic medicine. And Sara, you and I both met in a functional medicine clinic.
Yes.
And, we've seen some stuff and we wanted to kind of talk it through and give people a different perspective. So do you want to kind of lead us to what we saw?
We saw the same things over and over again where people were coming in looking for the next lab value, the next supplement that was going to shift them out of symptoms, basically, or their chronic illness or whatever they were experiencing at that time, whether it was mental, emotional, physical. And what we saw was this was actually kind of disempowering, right? Is that we would do all of these labs and we'd see everything that was broken. And then we would try all these supplements and it only moved the needle so much. And we saw this with other practitioners too, that we'd throw all of these supplements at them and it's was really expensive, right? And they would only do so much. It's like we would make them a little better, but it wasn't really where the work was at. And I know you saw this too, and even you said you were feeling disempowered, right?
Yeah, I felt like we were disabling patients in a way because it just felt like we reduced them to just biochemistry.
Mhm.
Whereas, like, we're human beings, we're interactions with the environment and the people around us. And like our physiology really is actually responding to what the nervous system is sensing. So
Mhm.
we were totally, I felt like, missing the nervous system component. That also was reduced to just fight or flight and rest and digest, and oh, you just need to relax more. Whereas like not like the nervous system is way more intricate than that and brilliant than that, where there's all these different adaptations that happen and your physiology follows. I mean, you and I learned this a little bit, after we decided to kind of leave, functional medicine or like a traditional functional medicine practice. But I just felt like it was very disempowering for the patient and for me. Like, I just felt like I don't want you to need me. I
Yeah.
want you to know how to take care of you. And, I felt like I wasn't trained that way, in the training. And I was pretty kind of upset about that in a way. Like, you think holistic medicine, you're going to treat the person as a whole. But I felt like we were just treating lab values again.
Yeah. And I know you and I talked that that still felt conventional medicine, is that we looked at a lab value and we reduced them to that lab value. And we said, okay, now we have to give you this supplement and this supplement. And then some people, what happened is because they were so severely dysregulated or in such a shutdown mode that the supplements they would be sensitive to or react to, and then they were more disempowered because these supplements we were telling them you need in order to shift, they were like, "Ah, my system is saying no to it," because they were in such a shutdown mode that their system was not able to take those things in. And it
Mhm.
could be more frustrating, more disempowering, and more sending that signal that they were broken
They
and they
really
were
were
hurt.
broken. Yeah. And it's like they're not broken. It was actually the brilliance of their body, for there's an adaptation that can happen where the nervous system goes into shutdown mode, where it's trying to conserve energy. And if you're trying to give all this stuff and it can't digest it, it can't absorb it, it can't do any of that because it's not in a state to take something in. And so that's what you and I learned after, what we were trying to learn as much as we could. And so, looking back now, it was like, oh, man, like knowing what we know now, it was like, oh, there was a lot of stuff that we could have done differently with patients. But that's okay. I mean, like
Yeah.
we know now, and I think that's why we're so passionate about treating about it. But like this is kind of a common theme that I see now with patients is like, you know, um, the ones that are still looking for something wrong. That's also a culture that's been embedded with functional medicine is like you have access to all these kind of really nitty gritty, detailed, expensive tests that
Yeah.
people think they need, because that's what's going to solve their symptoms.
Yes. Yeah, they think it's the next thing, but that keeps them in this dysregulated state because they think they need to solve themselves. They constantly are looking for what is wrong with me. What do I need? I am missing something. And that's also, you and I talked about this a lot, is that is a fight or flight type of energy too, where you're constantly problem solving, constantly looking for the next thing that is wrong, when really our systems can synthesize a lot of things when our nervous system is open and able to do that. But when we are in these dysregulated states, whether it's shutdown or fight or flight or a combination, you can't. You really just get stuck in this adaptation that keeps you from being able to respond appropriately to your environment, to work through these things, to detox these things, to, properly move through these states. And then you just get stuck, and then you keep going to us for answers and spending lots of money on all of these different supplements. And then you move the needle, but it's still not the next step. And
Yeah, I will tell you, like, even like, patients who were able to take supplements and did see improvements or whatever, it never stuck because they didn't address the nervous system. So for example, like, so it's a little bit more concrete for people in the physiology. Like, if you're in a constant fight or flight state or a shutdown state of the nervous system, your digestive fire or the ability to break down food and absorb the nutrients from it is not optimal because your body has sensed a threat, right? And so there's a tiger in the room. The priority is run away from the tiger, not digest your food. And so you're not going to absorb your nutrients as well. And so if you're like baseline isn't working well, like, no matter, you're going to feel better if you throw nutrients at it. Of course, if you can take them in, you will feel better. But when you take that away, what is left? Right? If that system isn't working good, and you need to feel safe for that to feel good. And so I think what gets missed in our culture is that because we've normalized this go, 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 fight or flight, you're weak if you're got symptoms or whatever it may be, that we're not realizing that we don't actually feel safe in our body. And that's why we're not repairing correctly. And that's why we have the symptoms we do.
yeah, and you and I even talked functional medicine. A lot of offices are trying to integrate more of this nervous system work, but sometimes it's so superficial. It is let's do breath work. Let's throw some breath work at you to regulate, when really, as we know with our knowledge of the nervous system, breath work to make yourself feel better can actually keep you dysregulated, because you are in this state of like, I need to process through this. I don't feel good. And you're trying to control your breath. Yeah, in a way that's trying to suppress the emotion, which is actually fighting the physiology, which sends a signal to the nervous system we still aren't safe. So even in the functional medicine realm, there is some let's calm your nervous system, but it's still,
I agree.
yeah, it's still the very basic, and hopefully it'll we're hoping to change it and get it to the more nuanced way that, yeah, breath work for some people might help, but it also might just make you worse.
Mhm.
You are dysregulating because you are really fighting what you're feeling in that moment. You're really afraid of what you're feeling, and you're like, okay, if I calm myself, I have to calm myself. And we're afraid of the dysregulation, so it stays.
Mhm. Yeah. And so, I think it's also knowing what tool at what time to use. And it's not to fix, it's more just to meet yourself where you're feeling that, whatever symptom it may be, anxiety, tightness in the gut, tightness in the chest, whatever, pain, you name it, the symptom. The goal is actually not to be afraid of the symptom. The symptom is actually brilliant.
Mm-hmm.
It is there to show you something is off in, either your own regulation, your interaction with the environment, or the people that you're around. Like, for a long time, like, my system was in shutdown because I sensed threat with someone that was in my kind of who I would see very regularly.
Mhm.
And so I was in shutdown and I was just like tired all the time, no matter how much, good habits I had, I still couldn't shift because I was in shutdown because of, someone I was sensing as a threat.
Yeah, you were interacting with your current environment, which if we don't shift our current environment, if there's something in it that is keeping us in the state we're in, there's no amount of breathwork acceptance or anything that will tell our body we're
Therapy,
safe.
or, yeah, no
Yeah,
amount of medical supplement that you're looking for.
yeah.
Yeah, it's just, it can help take the edge off, but it's not going to get you to move the needle.
No, it's not. And also, if it could also be not something current, it could be something past that's trying to show itself so you can process through it. And if we're really afraid of that, for running from it, then we stay in the fight or flight. It could just be this emotion that has been stuck for a long time that keeps showing itself. We call them, or triggers is one thing a lot of people call them, but it's usually something from the past that we haven't grieved, we haven't worked through, we hadn't able to emote properly through, and our body stayed into this. Okay, well, we didn't process through it, so we're unsafe. We were too unsafe to process through it, so it still thinks we are unsafe until we sit with it, till we feel it, till we are able to use these tools to really
Mhm.
help allow that be there, and then it moves.
And I think like what we're trying to do is also like share with people that these feelings, it's not like you need to like go talk about them 24/7 to heal, but it's more about bringing presence to them and the actual sensations of them rather than, needing to go back and dig through the past and all of that. Because that can seem overwhelming to some people too, but it's really just learning yourself, learning your tools, and this is more empowering, I feel like, because you become a stronger version of yourself. Brain body connection gets stronger, and then you feel better, then you do better in the world, then you can interact better with other people. So it's got a really nice trickle down domino effect of training your nervous system.
It does, yeah, and it shifts your life, it shifts how you interact with your environment, and it builds safety in yourself so that you can show up how you want to.
Yeah, so that's way more empowering to me. And what's
It
really cool is like you get to see that shift in the biology when you do test again.
Mhm.
So it's just, if people knew that rather than concentrating on the labs, concentrate upstream, this will shift.
Yeah, with time and with presence, it definitely shifts, and you and I have both seen this and now have seen it with clients, and hopefully we're moving a little bit away from that functional medicine structure, to this actual holistic looking at what's showing up for us and not just giving it a pill or giving it a supplement or an herb or something to make it go away.
Yeah. So it was funny, like for me, even I felt like as a practitioner, it was dysregulating because if you look at how many supplements are out there, every day there's some new blend, some mushroom blend, some this blend, some antioxidant blend. And then getting questions about that, it would drive me insane because like everyone would just think that that's their magical cure, like which form of magnesium and all this. And I'm like, I can't even keep up. Like, I don't want to keep up.
Yeah, and it's disempowering because then it's like, okay, do I need that? What am I
Mhm.
going if what's going to happen if I don't take that?
Right.
That I need to keep up with this current culture of what the new supplements are and what my body possibly needs. And that's just what we're trying to move away from.
Yeah. So hopefully this was helpful to those of you who may have been through functional medicine. There is hope. There is a different way to train your brain body connection, and ultimately, I think is much stronger in the end. So
Yes. And you and I will be putting out courses for those who want more of that assistance to move through it and learn how your nervous system and what it's telling you and how to move through all these different states.